And yeah, so basically for my project, I talked about harm reduction policies and specifically how needle exchange programs can be looked at as one single example of harm reduction, and how the overwhelming evidence for the benefits of needle exchange programs can translate over into an argument for a greater expansion of harm reduction services to all other fields. In the process of doing this, I talked to a couple of different organizations. I talked to DanceSafe, which is a harm reduction group that basically focuses on drug testing and drug usage in the EDM and festival scene, which is a little bit different than the people that the harm reduction or the needle exchange field works with. I talked to HIPS, which is a harm reduction nonprofit in DC that focuses on sex workers and basically any of the care and harm reduction services that would be appropriate towards those groups. I talked to the Drug Policy Alliance, and then I also talked to another member of DanceSafe. So just like starting off the bat, basically introducing the paper, I talked about how in the United States, drug users are like not really viewed as full members of society. They're either heavily, punished or put into the criminal justice system like they would be treated with, committing violent crimes. And then basically also talking about how the war on drugs has been a pretty abject failure. So I don't want to get too heavily in depth and just, repeat the entire research paper, but the war on drugs has not done what it's intended to do. The United States spends $182 billion each year imprisoning 2 million people. There's been no reduction in the usage of drugs in the United States since the war on drugs was escalated by Ronald Reagan. In 2017, 7.5 million people had some sort of illegal drug use, or illicit drug use disorder. So that means 7.5 people are either using cannabis or cocaine or anything else that would fall into those like categories of prosecution. And then perhaps most importantly, 7,237 people have died from overdoses of various drugs. While a lot of these overdoses are related to opioids, there's also overdoses of stimulants like cocaine and methamphetamine, along with things such as bath salts and other issues. Alcohol is also a contributing factor in a lot of these overdoses. So I let Hannah read through my paper and ask if she had any questions. So I'm going to open up the chamber to have her ask if or see if there's any questions she wants to ask.
Yes, so I think the most kind of confusing part of all this for me is a lot of the statistics that you talked about where other countries across the world have very starkly different views on needle exchange programs and other harm reduction techniques and how the WHO really supports them. So I'm just kind of confused as to how globally, global health leaders can have such a different view and different recommendations than what actually gets done in the US. What is it about the US that makes it so inclined to actually do take on these harm reduction methods?
I think that can be a question that's applied to a lot of different issues in the United States, and I think it just boils down to a severe cultural disconnect with what the reality of life is in the world. I mean, you can apply that same question to why the U.S. has such a problem with gun violence, why the U.S. doesn't have any sort of legitimized national health care, why it doesn't have paid leave or maternal leave or sick leave or anything along those lines. And I think that just the United States has had basically the origins of these drug laws started as racist techniques to imprison Black people and Hispanic people along with political dissidents. And so that started in it's ran back to about the 40s and 30s, but it was ramped up pretty heavily by President Nixon because President Nixon was not a fan of many of his detractors and wanted to be able to prosecute Black people and Hispanic people more freely. And then it was just increased by Reagan, and it's just kind of stuck along since then. I mean, we've seen a bit of a decrease in how the United States prosecutes and treats drug users, I mean, just earlier this week, the Congress voted on decriminalizing cannabis for the first time ever. It's not going to pass the Senate, but it's being approached, or at least talked about now at this point. And I think that just because of that, we're so far behind everything else in the world that right now we rely on, like, I guess not what's the word that I'm looking for? Outliers, but like individual actors. So like, different community public health leaders and nonprofits and stuff like that to do the work that the federal government really should be doing itself.
Mm-hmm. I guess the other question I have is, like, why specifically are needle exchange programs so restricted? Is that just kind of a symptom of the fact that the US is so against harm reduction?
Yeah,
Or is
so
that,
I
is there something about needle exchanges that like introduces additional barriers?
No, so I mean, I talked about this a little bit in my paper. So the representative in Congress that basically introduced the reduction in restrictions on harm reduction or on needle exchange programs was Representative Hal Rogers, who is a Republican from Kentucky, so one of the more conservative states with a conservative leader. And he acknowledged that, and this is a quote from him in an interview with NPR, the prevailing viewpoint is that they do promote the usage of needles and drugs. So for the people that don't really are introduced to this and don't have any idea of like what harm reduction is and what needle exchange services would like be providing as a benefit, you just tell somebody we're distributing free needles to people that consume heroin, somebody that's been taught for the majority of their life that like drug usage is bad and immoral and like a result of like selfish people or however they are described it. Distributing free needles to people that are doing that is something that just doesn't make sense in a lot of people's brains. So one of the things, and I tied into this with the interview of the volunteer coordinator that I talked with at HIPS, but like one of the biggest barriers to even starting to approach this as an issue is re-educating people and like expanding and having like these conversations about it. Because at the current moment, like people in the United States just don't care or like are actively against helping these kind of people.
Yeah, I thought another thing that like really stuck out to me when I read your paper is that that there was research that was done that showed that one of the biggest barriers for drug users, like who wanted to access needle exchange programs or similar things, is like fear of being arrested. I think that just goes to show how damaging that criminalizing drug use, like how damaging that can be, because even when there are there's like help available and like safer alternatives available, there's still the kind of fear of like of punishment that keeps people away.
Yeah, I mean,
I think that's really messed up.
It's definitely not a coincidence that states that have the highest rates of hepatitis C and HIV and also just overdose deaths in general are typically more conservative states. So the leader in both of those categories is West Virginia. Maryland actually, as of 2018, has the second highest overdose fatality rate. But other states like Kentucky and Ohio, and just typically like more I guess tough on crime states are the states that are having the biggest issue with this because there is no alternative for people to turn to.
So why did you choose to focus on needle exchange programs?
So I think needle exchange programs, there's a lot of data that you can look at with like a scientific, or not even scientific. There's a lot of data that you can look at in terms of like just directly attributing the implementation of harm reduction services to a reduction in HIV infections or hepatitis C infections. So I talked about both the cases in San Francisco and in Vancouver, where the implementation of needle exchange programs like drastically reduced their caseloads of HIV. And then also how a lack of harm reduction services has led to high rates of hepatitis C in places like Ohio. And I think that also because it's a bit more of a controversial one than like maybe just HIV testing in general or like distribution of fentanyl strips And I think that people like just the idea of like passing out needles like a direct paraphernalia just doesn't sit right with people. And I think that like trying to explain why it is a good thing and like ease people's thoughts may make it easier to ease their thoughts on other forms of harm reduction. So.
Um, so your solution, I kind of surprised me because I thought it was kind of broad for such a specific such a specific harm reduction method. Because you said the solution is to decriminalize drug use,
Mm-hmm.
and that kind of caught me by surprise because it's really general, and needle exchange programs are kind of specific.
Yeah, so I think that what I wanted to focus on is how needle exchange programs benefit just the idea of harm reduction in general. And I think that like the first step towards making harm reduction services better or needle exchange program services better would be to just to fund them more and to open up funding for them. However, I don't think that that's possible without first decriminalizing like the idea of drug usage. I don't think that you're going to find any people like, you know, the bill that reduced the restrictions on needle exchange program funding, that's great. I think that that's something that like has been long overdue, but you will be very hard pressed to find anybody, even like on the Democratic side, that's like willing to federally fund these sort of sites. Right now, it's entirely state-based or in like donation-based. So I think that for any like legitimate change to be happening in the future, you have to strike like at the root of the issue, which is like people view drugs as wrong and view drugs as like, you know, somebody's fault. It's not a result of any sort of like systemic issues or, you know, anything happening besides like just their own personal fault. So I think that the first step to doing that, and you know, maybe 10 years ago this would have seemed like a completely insane idea to approach in the United States, but we've seen in the past, you know, 2 years a pretty radical shift in how people perceive drug usage at the state level, at least.
Mm-hmm.
We've seen multiple jurisdictions decriminalize psychedelics and psychedelic mushrooms.
Yeah, DC just did that.
Yeah, so DC did that. Ann Arbor, the city of Ann Arbor in Michigan did that. Colorado has done, or not Colorado, Denver. Denver's just the city of Denver has. And then, you know, just this past month, Oregon decriminalized all of like drug possession. And I think that like looking at Oregon didn't come up with this policy just out of thin air. You know, this has been a program that actually let me take a step back and explain why I think Oregon's the model that should be looked at. So Oregon in this most recent election basically passed a proposition that decriminalized all drug usage. So it still criminalizes drug possession and drug creation. So if you're distributing like large scale quantities of, you know, heroin or cocaine or whatever, you're still going to prison for the same amount of time. If
Like
you're creating,
UNC's
yeah,
fraternities.
like UNC's fraternities. However, if you're like petty possession, so I don't know what the exact requirements are. I think it's like under, you know, 5 grams of cocaine or under a certain amount for, you know, heroin and whatever. You, instead of being, you know, slapped with a couple of years in prison or given a felony or given like a misdemeanor, you're instead redirected towards treatment services and, you know, volunteer work and you know, things like Narcotics Anonymous and stuff like that. And instead of just, you know, putting the burden of these services onto the people, which are overwhelmingly like poor, less affluent people that have these issues, they're using the huge amount of funds and resources that have been generated by legal cannabis, which is an entirely separate issue, but
Mm-hmm.
they're using those funds and the taxes from those to pay for these services. Because I think that the people in Oregon understand that like trying to, you know, cut off the heads of Medusa by, you know, arresting a drug user isn't going to do anything to stem the issue. What's going to stem the issue is like preventing people from getting addicted in the first place and preventing, you know, this entire thing to be driven further and further underground when it's obviously not working. So, but Oregon's policy for this didn't just like come out of thin air. It's been worked on for a couple of years by the Drug Policy Alliance, and it's modeled after a couple of different systems, mainly Portugal's system, which Portugal's had this sort of system in place, not with the cannabis, because cannabis actually is still illegal or decriminalized in Portugal, but the government does not prosecute like petty drug offenses and instead uses government funds and the healthcare funds to allow people to attend treatment services, which is how I think the entire United States should be doing this. But I think we'll see how this works in Oregon. The law actually hasn't been implemented yet. It doesn't take place until the new year. But I think that it's something that like we know that it can pass. We know that it can happen. And it might not be happening in states that are, more conservative and are harder hit by this, like Kentucky and Ohio and stuff like that. But, I think that it's a very real possibility for it to happen in the future.
Yeah. And you did bring up that one legislator, I don't remember what state they were from, but they were conservative and had previously been against needle exchange programs, and they ended up switching their position once they were confronted with how bad of an issue it was in their state. So it's possible.
I think it's possible. I think that it's going to take a far longer time for it to take place. But I mean, if you had asked anybody 20 years ago if like half the states in the United States you'd be able to walk into a weed store, like a liquor store, like I think that people would have thought that was just insane to think about. So
Yeah.
I don't know. It's hard to predict and look into the future, but I think Oregon's bill passing, and I think more states looking at decriminalization rather than over prosecution is something to have hope and look forward to. So I think that kind of briefly surveyed everything. Is there any like specific questions you had about the data itself, or any like individual points you wanted to talk about?
No, I kind of asked all my questions. Most of my like questions weren't as specific on like needle exchange programs, but I asked everything. So
awesome. Well, thank you for being a guest on my show. I appreciate you helping out with this project. So yeah, I don't know. I'll edit down this tonight and I'll send you the finalized copy if you want to listen to it.
You want me to listen to my own voice?
I mean, I'm not listening to my own voice, so. All right,
Yeah,
well, okay. Break. Thank you for being a guest on this project and, or I guess this show. I appreciate you taking the time later today to help me with this. So.
Anytime.
Thank you. All right, and this is my policy 388D presentation. Yeah. All right, bye.
Bye.